Hi everyone. This is our editor's choice Cephalalgia article of editor choice today about migraine and sleep. We have two wonderful scientists and our authors, Dr. Omland and Dr. Mykland. Could you please tell us a little bit about yourself and your institution, and what brought you to publishing this amazing article, which we congratulate you today on?
Thank
Please,
you for
maybe
a,
start here.
yes, thank you for a very nice introduction, and thank you for selecting our paper as editor choice. It's a great recognition for everyone who has been involved in this work. So I'm an associate professor and a postdoctor at the Department of Neuromedicine, Movement Science at the Norwegian University of Science and Technology. And this paper is the last publication in a series of studies which we have done on the connection between migraine and sleep. And in Trondheim, we have been conducting studies on the neurophysiology of migraine for almost 20 years now. This work has been led by Professor Trond Sand. And on the our latest studies has been on migraine and sleep. And these studies are done in collaboration with the Norwegian Center for Headache Research, NORHED. So yeah, and the basis of the study is that there's a well-known but largely unexplained association between migraine and sleep. So patients can tell you that sleep can help during their migraine attacks. It can ease the migraine attacks, and that disturbed sleep can trigger migraine attacks. And we also know that migraine patients often have reduced sleep quality compared to others. And from epidemiological studies, we have seen this connection as well. In our region of Norway, we have a large epidemiological study called the Hunt study, which have been conducted since 1984. And data from this study shows that persons with disturbed sleep have an increased risk of developing migraine. So we are very interested in trying to understand this connection between migraine and sleep. And therefore, we have developed a study design to do this, where we investigate the effect of reduced sleep on several neurophysiological measurements. And in this study, we have focused on pain-related responses. So that's some of the background. Anything you'd like to add, Martin?
Yeah, so my name is Martin Mykland, and I work with Petter Omland at the NTNU, Norwegian University for Science and Technology, and in the Norwegian Center for Headache Research, NORHED. And um, this study is based on what we previously have sort of discovered with this large series of migraine physiology studies. And it's a sort of a natural way going forward based on our previous discoveries.
That's amazing. And I know that you have fantastic combination of different departments at your university working together, which is collaboration is so appreciated, including very appreciated statement from Dr. Michael how migraine is one of the most interesting brain disease. So
Yeah.
bringing technology with interest to headache medicine and improving life of people living with migraine. What were the methods? How did you think about this study? That's quite an outstanding study, including methodology. Could you tell us a little bit about how you use control group and how you approached it?
Yes, we would love to. Because as Martin said, this is we've done several studies on migraine physiology and has got a lot of experience from these previous studies. In this study, we have a blinded crossover design. So we have a migraine group and a control group, and in each participant is examined twice after habitual sleep and after sleep restriction. And this is very important because neurophysiological local measurements have a considerable variation, and it's important to compare the subjects to themselves and therefore conduct a series of measurements in the same subjects. That creates more robust results. That's one of the things we thought about. And to investigate migraine and sleep, we know that reduced sleep affects several measurements, several neurophysiological measurements in healthy subjects. And it's a great interest to see if that also affects how that affects migraine patients, to see if you can understand its connection between migraine and sleep better. I think that neurophysiological methods are very useful to investigate migraine because they provide they are non-invasive and give insight into the central nervous system of migraine. It's like a window to the brain, and we can learn a lot from migraine using these methods.
That's excellent. Yes, Dr. Mykland, you wanted to add?
Yeah, so many previous studies has also seen very close connections to the parts of the central nervous system which is involved in sleep mechanisms. They are quite closely connected to parts of the central nervous system thought to play a part in the migraine pathophysiology. So it's quite a neat method to try to modulate these mechanisms and see how they behave in different states depending on sleep, and to see if we can discover new things about the migraine pathophysiology by collecting data in different sleep-related states. That's a bit of the idea behind this type of study design.
How would you determine what is lack of sleep for participants? Would it be person with insomnia? Would it be person who reports lack of sleep on some particular night? I believe article describes that neurologist was participating in diagnostics in this one. Is that right?
Yes, and that's a very important aspect because all migraine subjects, they were evaluated by a neurologist to ensure that they fulfilled the migraine criteria and also that they did not have other comorbidities, including insomnia. So they should not have insomnia when being included. To investigate the effect of reduced sleep, the participants, both the the migraine patients and controls, were told to, for the for one examination, they were told to sleep normally, as they usually do. And for the second one, they were told to sleep less. They were told to sleep for no more than 4 hours for 2 consecutive nights. And then we conducted the measurements afterwards. So that's how they were actually applied sleep restriction. So they sleep less before one of the examinations. And then we could do our measurements both after normal sleep and after sleep restriction, after 2 different sleep conditions in every participant. And we can look at the difference. And to ensure that we're very proud of our study design, and to ensure to reduce source of bias, the order of sleep conditions were block randomized. So throughout the study, all same number of persons with migraine and controls had the sleep restriction condition first, and vice versa. So it's quite strict design. And to ensure that the participants slept as they were supposed to, they kept a sleep diary and also had an actigraph throughout the study period, so we can ensure that they had managed to follow the instructions regarding sleep. And our data show that the instructions worked very well and that they did sleep as they were supposed to.
That's wonderful. And what were the results? So we have participants with migraine and participants without migraine who have these instructions we just described with limited sleep on some of the nights, right, to 4 hours. What was the difference?
Yeah, that's a very interesting part, right? What was the result? And this is very interesting because we did find a difference in these pain rate responses, and it seems that reduced sleep had a different effect on these pain rate responses in the migraine group. And after reduced sleep, their pain responses were more rapidly reduced in the migraine group. They had an increased habituation. So during these stimulations, we stimulate with a nociceptive stimulus for some time and then measure the response continuously. And in the migraine group, we saw a large reduction, so-called habituation, after the reduced sleep condition. So that indicates that this reduced sleep has an influence on how persons with migraine, how their brain processes nociceptive signals. And I think that's very interesting. And we think that this finding is caused by increased inhibition in the migraine group following sleep restriction. Yes, and that's also interesting because in other studies that I looked at similar types of measurements in the ictal phase, in near migraine attacks, they have similar findings. So in a way, the sleep restriction causes similar findings as the ictal phase, in short. And we think that this indicates that the migraine patients has a vulnerability for insufficient sleep.
Absolutely. This is very common in the clinical life of many headache and other clinicians uh, to see connection between lack of sleep and migraine attacks. So what is your conclusion? And what is in the future for us? Do you have any future follow-up studies uh, going to be done based on what you found?
Yes, and maybe Martin can provide a bit more information here because this is one of a series of studies or publications where we looked at the effect of reduced sleep in migraine.
Yeah, and we have performed actually the same study design with the exact same sleep conditions while also performing other examinations into the central nervous system, and some of these papers is also published in Cephalalgia previously, and they show somewhat similar findings of changes in the inhibitory in certain inhibitory systems of the central nervous system. However, both these results and many previous results have found quite different type of inhibitory responses depending on type of stimulations provided, and there have been many theories in the migraine field trying to describe these differences and also some discrepancies regarding those results. And it's a difficult field to go into, but we have found very interesting results now indicating that sleep restriction alters some of the inhibitory functions of the central nervous system in migraine, and as Peter said, these latest findings show quite similar responses as what we see when the migraine patients go into the headache attack, the ictal phase. And we of course want to follow up on this going forward, and the sleep condition ID is still quite interesting, but we also need to understand a lot more about the timely changes going through the migraine cycle and what happens when the prodromal phase of migraine starts in specifically. So we will try to go forward with this inhibitory changes hypothesis and do new evaluations of the in part the thalamocortical system in migraine and how it changes throughout the migraine cycle. And I think that's a very interesting field to look into further based on these results.
That's wonderful. And there is something to be said about this rhythm of sleep too. So I was wondering if sometime in future research we might see answers for naps. Are they good? Are they bad? So sleeping outside the schedule. So we have uh, a lot of questions. What is the right amount of hours to sleep? How person should be planning their sleep schedule? It seems like sleeping definitely more than 4 hours sound to be good recommendation for now.
Absolutely.
Yeah.
Thank you so much, and thank you for joining us. And wonderful, amazing article in the Journal of Cephalalgia. Our editor, Dr. Sacco, she is doing this fantastic work, and we hope to see more of your articles and more answers to mystery of migraine and sleep from you. So thank you very much.
Thank you.
Thank you. Thank you for having us.